Good evening. Hello. Long time no see. How the devil are you lot? Well, you've probably seen today. One, I am not in our usual room, but I am today talking to you with the wonderful Mr. David Ogutu. Hi, Julie. Mr. David Ogutu, who is going to be joining us from Herts Essex Fertility Centre. I'm going to be talking about a few things. We are going to be chatting about men's health, and then also the reasons why people turn to surrogacy and some of those conditions. So we'll be going live very soon with Mr. David Ogutu, who's one of the consultants at Herts Essex Fertility Centre. So just bear with me 2 seconds, and I'm going to go and see if I can get David joined on to this live. So just let us know where you're watching from. And I'm going to go and get the wonderful David. And if you've not met David before, then you're in for a treat, because he is one of the nicest consultants that we work with, and that our intended parents get to interact with when they're going through their journeys. So let me just check if David is here. Just bear with me 2 seconds. This is the bit where I look a bit weird, because I'm having to go through who's currently here and who isn't. Cool. No, it's not there yet, so that's fine. So just to recap what we're going to be going through and chatting about. So the whole focus for November over on Two Dads has been Men's Health Awareness Month. And with International Men's Day last weekend, we were talking about sperm health and how to look after ourselves. But I wanted to continue part of that conversation, really, and talk to David a little bit more. Just really about preparing, if you are someone who produces sperm, preparing yourself for fertility treatment, and what does that look like running up to that first part of fertility treatment. And then we were going to talk in a little bit more detail about some of those conditions that you may have been diagnosed with that mean you have to turn to surrogacy. And that could be unexplained infertility and recurrent loss. It could be MRKH. It could be a whole host of things, and we're going to talk in a little bit more detail about that in case any of that impacts you too. But most of all, it's such a wonderful chat with David. It's always an absolute pleasure, and you'll see why when he's on your screens in a wee bit. So just give me 2 seconds while I go back into my messages and just message David and see how he's doing. So just give me 2 seconds. Let me know where the heck you're watching from, because that would be I'm always a bit of an absolute nosy sod, so I love to know what everyone else is up to and where you're watching from. So tell me that. And we're just waiting for David now, so everything's all this guy. Hey India, nice to hear from you. Miss you too. How are you? So Herts Essex have just joined, so I am just hopefully getting David here now. Right, it looks right, everyone. Here we go. This is where I pray that it works. Ta-da! It's trying. Come on. Hello.
Hello, can you hear me?
We can hear you perfectly. How are you doing, David?
I'm all right. Just finishing off at work.
Oh, you're a ledge. Thank you so much for staying just to get this done as well. How's things?
No, not too bad. Not too bad. Yes, busy as always. But yeah, coming to the end of the week, so looking forward to a weekend off.
Yeah, no, I bet. And the last time we spoke, there was a certain team playing another certain team, wasn't there? Do you remember?
Oh, went well.
um, We'll leave the fact that you're an Arsenal fan for another day. But that was it was a moment. I think you were playing Wolverhampton Wanderers last time.
Oh yes, yeah, yeah. We
You,
got away with a lucky win. Yes, as always.
you did indeed. Okay, so what I wanted to chat with you, David, for those people that are either new to Two Dads or for those that are joined specifically to hear from you, I know a lot of our intended parents, you are their consultant through their particular fertility journey. So I'm really keen to hear from you. One, obviously, with it being Men's Health Awareness Month, one of the things that I wanted everyone to hear is a bit more about you firstly. So if you can just let everyone know a little bit about you and your background and what you do there at Herts and Essex, and then we'll jump in with a couple more questions.
No problems at all. So thanks everyone for joining us. But I'm Mr. David Ogutu. I'm a consultant gynecologist and fertility specialist here at Herts Essex Fertility Centre. We are one of the UK's oldest fertility centres. We do quite a lot of work with my two dads in terms of surrogacy, and that's surrogacy for all a myriad of reasons. But it's not only surrogacy. In IVF unit, we do investigations, provide fertility treatments, donor eggs, we've got a sperm bank. So all possible fertility treatments, yes.
And how long have you been there, David?
So this is going to 12 years now. Yeah, so we've been here quite a while.
Amazing,
Yes.
amazing.
Yes.
Okay, so let's just jump right in then, if we can. Obviously, Men's Health Awareness Month. We've had a few blogs this month just talking about sperm health and how to prepare yourself for fertility treatment. Talk to us if you can, and then we'll jump into some more detailed questions around infertility. But just for those that are either watching now or on replay later, the importance of looking after sperm when you're embarking on IVF or surrogacy. What's the typical advice that consultants like yourself usually give people when they're preparing for that particular part of their journey?
Yeah, okay, so what to emphasize to our patients is that to make a baby, we need two ingredients. We need sperm and eggs. And for a long time, the emphasis has been on eggs and women's health, but the other half, which is the sperm, is very, very important. The advantage we have with sperm is sperm is continually produced. So, each sperm is usually going to be 6 months old, as opposed to eggs where women are born with a certain number of eggs and don't make any new eggs going forward. So with the sperm side, with the sperm side, we have opportunities to repair any damage we may have done to the sperm in the preceding months. But getting into fertility treatments or trying to conceive naturally or storing sperm for future use or for surrogacy it's very important that the sperm is of its best possible optimal quality. And things that would affect sperm is any oxidative stress, so things like cigarette smoking, excessive alcohol use, if you've been under the weather from a cold or things like that, it all affects sperm. So taking good care of ourselves health-wise, BMI-wise, avoiding oxidative stress from especially cigarette smoking, excessive caffeine, all makes a big difference to the chances of successful conception.
Yeah, and I think one of the things that we spoke about previously is that importance of diet and all of those environmental factors leading up to providing a sperm sample and getting it's a cliche, but it's that getting fit for fertility, and it's understanding how we can look after ourselves and our gametes in order to provide that optimum sample. How many people tend to arrive at a fertility clinic not knowing that?
And unfortunately, it's the vast majority because in many cases, most of the men or patients we see or clients we see would have attended an open evening. They would have had some information, such as from yourself, forums like this. So the awareness is improved significantly. Most men are coming in now knowing that they need to have taken good care of their health and to optimize the quality of sperm when they're coming for tests or to produce a sample. But we still find most of this assumption that all I need to do is produce a sample and all will be well. But your health and how well you've been taking care of your sperm production in the preceding 6 months to 12 months makes a big difference to the quality.
Mm-hmm. Absolutely, and we've definitely noticed that, and have had a number of intended parents that have realised that there's more yet to be done with looking after their own health, and that may be having to go away and improve that sample because it's not of optimum quality, and having to, I guess, where women have been more aware of their fertility because of the generational issues where infertility was often always considered that it was the woman that needed to improve their fertility, whereas the focus never really being on men, and that shift thankfully has changed, and it's about educating people that up to 40-50% of men still need to look at their own fertility.
Absolutely. Yes, and 30% of causes of difficulty conceiving is purely to do with the man. 30% is because of a combination of both. 30% due to the woman. So we still play, and men still play a big role in the outcome of conception. But we've got big advantages that we've got technology to bypass some of those deficiencies that there may be with the sperm. But of course, the better the quality is, the better the chances it will work, the less the risk of miscarriages, and it all makes a big difference. Yeah.
And again, that's something else that I wanted to quickly touch on. Obviously, the better quality sperm and egg, then the less chance of that embryo rejecting. Essentially, it's all about those optimum ingredients to ensure that embryo sticks and stays. Is there any additional research going into that space, David, that's looking at whether that's recurrent miscarriage or embryo quality? What more are clinics doing in this space to ensure that really is optimized?
There is lots of research going on, but mainly lots of it takes a while, a significant amount of time for research to then come into clinical practice. So there's lots of work into things like oxidative stress. There's tests for that, but the tests basically tell us that if you've got high oxidative stress, you need assistance with the sperm to be injected into the eggs. But what we're seeing a lot coming through is that in terms of implantation, miscarriage, the main culprit usually is that embryo, that egg and the sperm having come together, created an embryo that is not viable. So if it's not viable, it will either not implant, or if it implants, then it's very likely to miscarry. Now, with improving technology, especially in terms of screening embryos to determine which is the best to go back in, we're using either the crude microscopy that we've used for a long time to fine-tuning that with much better imaging of the embryos, but also moving towards genetic screening of embryos to determine which ones are the best available ones to put back in, means higher chance of implantation, but also minimize the risk of miscarriage. But unfortunately, all these tests cannot make an abnormal embryo normal. So we've still got to optimize the quality of the eggs and the sperm to increase the chance of a normal embryo, so that when we bring in all these tests to help us identify the best one to go back in, it gives us a better chance. But the tests need to be supported by better quality sperm and eggs getting into the process.
Yeah, absolutely.
Yeah.
The need to look after yourself when you're on that fertility journey, whether that's a fertility dietitian or just understanding if your lifestyle is optimized for fertility treatment, I suppose.
Yes.
Okay, interesting. Again, if anyone has any questions, then please feel free to pop them down in the comment box below, and I'll certainly do my best to answer those with David. But one of the things that we wanted to look at then, so you are pretty responsible for the majority of a lot of the patients that come through either 2dadsUK or my surrogacy journey that you see. And we have a number of intended parents that have a variety of conditions as why they need surrogacy. Obviously, there's those that are two men that come through, two cisgendered men that present that obviously need to do surrogacy. But let's look at those couples, the heterosexual couples that arrive at the clinic that need surrogacy. So let's explore some of the conditions that, because to do surrogacy, you do need obviously the exemption or the medical right to access surrogacy. So let's look at some of those conditions that people do come to the clinic with. And I want to start with a condition called MRKH, which for a lot of people, they might not know what that is. Can you shed a bit of that particular condition, please, David?
Yeah, so MRKH it's called a congenital problem, which means you're born with it. It stands for Meyer Rokitansky Kushner Houses, or very long quadruple barrel name, which is a condition whereby some women unfortunately were born without a womb. So during the process of their reproductive organs developing, the womb and the cervix especially did not develop. Many of them have eggs. So where they don't have a womb, then they'll need surrogacy. So in many cases, it's possible to collect eggs from them, create embryos, and once they got a surrogate, then transfer those embryos back. They're genetically normal. Most young girls with this condition would find out that they have a problem only around puberty. So where everyone else is starting to get menstrual cycles, then they would not be getting menstrual cycles. When investigated with ultrasound scans, there would be no womb there. So, but in most cases, they've got ovaries, so it's still possible to produce eggs from them, mm-hmm. and create embryos for someone else to carry a baby for them. The other common condition we see with heterosexual couples requiring surrogacy, medical conditions, especially some women who are lucky to have cystic fibrosis, who in many cases would have required a double lung transplant. So their lung function means they're not physically able to carry a pregnancy. So they will not be able to physically carry the pregnancy because the lung function is not strong enough to support a pregnancy. So they would, of course, still be able to produce eggs, create embryos, and once they've got a surrogate, either through an agency or a family member or a friend, would be able to transfer those embryos back to them. Many other medical conditions, some severe kidney problems. Some women, unfortunately, may have lost their womb either because of cancer or heavy bleeding at a previous delivery, which means it's either not safe for them to carry a pregnancy, or unfortunately, some have an emergency hysterectomy. The womb is removed because of excessive bleeding during fibroid surgery, or most commonly following a birth. Not very common, but it's one of the scenarios where they may need surrogacy.
Yeah, and thank you, by the way. I think that's explained just perfectly. One of the things that really surprised me, certainly from a my surrogacy journey perspective, was the number of women that we would have that had MRKH. Obviously this condition, certainly within the surrogacy world, obviously is quite common, and you come up against it quite a lot within surrogacy. And it's only until you start, dealing with these intended parents and these women who have this condition. What would you say one of the main reasons as to why heterosexual couples come to Herts and Essex and need surrogacy? Is there one? Is it the unexplained infertility that tends to be the main, or is it those women that have lost their womb through to cancer or a traumatic previous birth?
No, the commonest reason is MRKH. So I would say for heterosexual couples coming to have surrogacy here, I would say out of every 10, I would say easily 6 would be because of MRKH.
Wow.
There is, and the reason why we're seeing lots more women with MRKH having surrogacy is that there's lots more awareness. So in the past, many would not get diagnosed until very late, or they get diagnosed and the assumption was that that's the end of their reproductive potential. But right from the word go at the pediatric gynecology clinics where they get the diagnosis, they're very well supported with the information that this is the condition, but it's not the end of your chances of having a baby. You could get eggs collected, create embryos, and many of them are coming in at a very early age to do that when their egg reserve is pretty good. They've got good quality young eggs, creating those embryos and preserving them for later on. Of course, having success stories. So, they've got support groups where there's women who've got the condition, who've had babies through surrogacy, would support those who are newly diagnosed. So the parents are supporting their young girls who've been diagnosed with the view that, when you're ready to have a baby, there is this journey. And most importantly, it's, organizations such as yours, you're making a big difference to lots and lots of couples who, through platforms like these, are then aware that, I may have a condition, this is how you diagnose it, there is a solution, get in touch with you refer them to the clinics with experience to deal with it. And it makes we're seeing many more getting on that journey at the right time. The problem we had in the past is not knowing where to go, who to turn to, and by the time you're finding out, it's probably 45, 46 years old, menopause is set in, it's probably too late, and maybe not bothering, but people are lots more informed, there's lots more awareness. We are getting educated by our patients every day as well.
Yeah, absolutely, and thank you for the acknowledgement of that. And we're seeing the same, and I think it's having those communities where you can talk to about those particular issues, especially around women's health. A few questions have come in. Firstly, there's some love, people thanking you for their children, for Lucy thanking you for her twins. But there was a question that came through. In fact, there were two actually. The first one was, from an expert point of view, have you ever dealt with directly methods or ways to improve motility? So far, pretty much have been told not much can be done aside from lifestyle changes. Obviously, with you being an obstetrics consultant, I didn't know how much of this question you could take, but certainly being a fertility professional, I'm sure you hear this a lot. So this particular man is clearly has an issue. It needs to improve motility. What would be your advice to someone like this?
Yeah, so with the motility, in addition, it depends on how bad the motility is and what the other sperm parameters are like. But in terms of lifestyle changes and use of antioxidants, so antioxidants, things like multivitamins, zinc, selenium, the one parameter we see improving the most is usually the motility. So for men who are producing, say, very poor, very low sperm numbers, or very high proportion of abnormal forms, whenever they make changes to their lifestyles and take antioxidants, many of those parameters don't shift as much. Some shift a lot, but many of them don't shift as much. But motility is the one parameter that we see shifting a lot. So people where the motility may be borderline and not able to conceive naturally, with lifestyle changes, it's one of the things that is most likely to improve. But of course, improving it means increase the chance of conceiving naturally. But even where not able to achieve a natural conception, with advanced reproductive technologies such as ICSI or PICSI, would be able to go around the problem, because the problem with motility is sperm not being able to swim in sufficient numbers to fertilize an egg spontaneously. But you can pick the few motile sperm and inject one normal motile sperm into each egg, and that would give us the same chance of success as if you had 100% normal sperm motility and you mix them together in a petri dish to rely on them to fertilize. So lifestyle changes, antioxidants would improve things, but if they don't improve to the point of being able to conceive naturally, then the advanced reproductive technologies would give you a very good chance of success.
Okay, great. And yeah, so I think it depends on how you wanted to conceive then, isn't it, really? If you are wanting to conceive naturally, then it could be a bit of a struggle, but the antioxidants are obviously showing some of the best improvements. Or if you're having treatment through a clinic, I'm not saying it's less important, because it's still obviously important to ensure that the right care is given, but having ICSI or PICSI will obviously help, because you're not relying on that sperm to swim necessarily. Okay.
Absolutely, yes.
Nicely answered. I hope that answered your question. The other one that came through, let me see. Oh, it's just gone off my screen. It was another question with regards to sperm health, but it comes back on. It looks like that question may have disappeared, but if you want to ask that again, please feel free to just press the question mark box. We're rattling through for time now, so I've got a couple more minutes left with David. What I would like to close with really is your thoughts on some of the frustrations, I guess, not necessarily within the fertility space, but with some of the common frustrations that maybe patients are faced with, or some of, a golden bit of advice that you can give for those intending parents that are at that very early stage of treatment, where it does feel like a real uphill battle. What's some of the best advice that you've heard to try and give people some focus and some confidence in this journey?
Yes, so I think it's almost always sounds like such a daunting, long drawn process. The experience we have when couples come through the door is that it feels like it's a very confusing, complex process. And the advantage we have working with groups like surrogacy journey, where the patients, where the intended parents are very, very well informed and taken care of. When they come to the specialist fertility clinic, they're much more informed about the process. But what we'd want, what makes it much more bearable is to think about the surrogacy process as a two-step affair. So step one is create embryos, and step two is put embryos back in the surrogate. Now, fertility is time dependent. So the younger we are at the point when we create the embryos, the better the outcome. So our eggs at 30 are better than 35-year-old eggs, better than 40-year-old eggs. Same thing with the sperm. So whereas it feels like a very complicated process, if you think about it, we come to the clinic, we've got regulations to ensure your safety of the surrogate. But when we break it down and you come to the clinic, produce a sperm specimen for the same-sex men, we test it, we know there is sperm, this is the treatment we're going to have. We usually try and get them in for screening tests as soon as we can. We normally get those results very, very quickly, produce sperm, freeze it for quarantine. Nowadays, it doesn't seem to take that long to get donors, because there's lots of young women who are aware of the difficulties there is to get donors. So we're seeing an ever increasing number of donors coming through. So most of our intending parents who are using donor eggs always come back and say, I didn't expect it to happen this quickly. So within a very short time, usually we get embryos created, and then the pressure's off to some extent in terms of we got embryos. It may take a little longer to get a surrogate, but again, there is amazing generosity out there. We're amazed at the number of women many of them have had their own babies, have completed their own families, but they're aware that there's this huge shortage of surrogates. They're always very, very willing to help. And within a very short time, the journey, what seems like a slow process to start with, almost always happens very, very quickly, because the surrogate comes through, they have their tests, and a month later, they're ready to go. And 6 weeks later, we're celebrating a positive pregnancy test. 3 weeks later, a pregnancy scan. So if we break it into two phases, think about it in terms of create embryos, and for the heterosexual couples as well, collect those eggs when we're young, create those embryos, bank them, and then the pressure's off. The surrogate would happen. The right surrogate will almost always come along at the right time for you.
Just beautifully put. Beautifully put. Absolutely, and it's exactly that we support and advise people on trying to break that journey down into those little compartments, just to make it less of an overwhelming experience, but most definitely getting embryos created and frozen, or sperm into quarantine, and getting that first stage done. But David, thank you so much. An absolute a privilege and a pleasure to speak to you again. I've absolutely loved working with you and all the work that you do for everyone at Herts Essex. So I want to say a massive thank you to you for joining us this evening. Go home now and have a great weekend.
I'm going to go home. Thanks for the invite, and thanks for everyone who's taken the time to join us, and all the surrogates who make who offer at no financial gain to themselves, offer themselves to help carry pregnancies for everyone else. I'm amazed at the amount of generosity from the donors, from the surrogates out there. So without them, our patients would be struggling to have babies. With getting to meet all these babies every day, and it's mainly due to the generosity of the surrogates and the donors.
Amen to that. David, you've been an absolute pleasure. I'm going to let you go. Go and go home. You deserve a break and a rest, and I'll see you soon. Thank you very much.
See you again soon. Thanks for your time. Thank you.
Thank you. Bye.